Hello, everyone. It's a pleasure to have you all, and today we are pleasured to have some of the leading cardiologists with us, along with the pride of the nation. Hi, I am Dr. Sunny Datta Gupta, Director of Publishing for Journals and Books at Scientific Scholar, and I'm honored to have the legend of the nation, Miss MC Mary Kom with us, and I'm honored to have Dr. Sarita Rao, leading senior intervention cardiologist, and Dr. Shiva Chhap, professor of cardiology and two of the stalwarts of women in cardiology and related sciences, the association which caters towards the healthcare issues of women, particularly with cardiology aspects, and these are the two names also associated with the mouthpiece of the society, which is the Indian Journal of Cardiovascular Disease in women. So for our audiences, I would like to start with Dr. Sarita, how this association of WINCAS came into existence.
So, Dr. Sunny, women as such, and when we talk about cardiovascular health or other health aspects, so traditionally it has been seen that, we have less data about women. If you look at the clinical trials, only about 15 to 20% of the subjects were women. And women, we know that they get care later. They are less attended to. They are less likely to receive treatment. And why is that when women form at least 50% of the population? So around 16 years ago, a group of 4 women who were headed by Dr. Jyotsna Maduri, who is our president, they formed this society called WINCARS, okay. Women in Cardiology and Allied Sciences. And from therein started our journey, and now we have 400 plus women cardiologists and allied sciences together. And in fact, today we had the Shakti Conclave, of which I was the post-director, and that again had all women cardiologists speaking on the same forum, presenting their data, talking about women-specific health issues, risk factors in women, STEMI in women, all of these things. So our story started 16 years ago to get more data about women, to give women a platform, to promote younger women to come up, and that has been our story. And we're very happy to have Mary with us, and today to unveil the new look of the journal by Scientific Scholar. So that is our journal IJCDW. So that's our story.
That's really exciting, and that's interesting. So I would like to ask Dr. Shiva that you are now going to be the upcoming editor of the journal. What are your visions of the journal, but how the journal actually came into existence, what it has been catering to, and what the future looks like?
All right, Dr. Sunny, as Dr. Sarita has just now mentioned that WINCARS has come up with this journal, and this was born somewhere around in 2016. And the idea of the journal is very unique, It talks about cardiovascular ailments, particularly in women. And to our knowledge, none of the journals so far in the world specifically addresses this issue, which is very relevant, which we have seen in the Shakti Conclave also in the last 2 days. So it's a double-blind, peer-reviewed journal with perfect clinical research content. And, even the editorial board has got most of the women cardiologists across the country and internationally also on the board. And we really look at the future that we should be having more of scientific content in the form of original articles, reviews, research papers, so that we can actually make the difference at grassroots level as well as at a larger level in society at large, to make a difference in the cardiovascular ailments in women, study their risk factors, and improve the management profiles. So I would also like to say that, of course, as I always say, and we agree, that it has been through the sweat and blood of Dr. Jyotsna Maduri, who's invested her years for the purpose of the cause of organization as well as this journal.
Excellent. That's really exciting and motivating. And my final question would be to Mary. Like, we all are pleasured and honored to have you here. What is your feeling when you associate with such an unique organization? You see practicing women cardiologists doing their best in life. How you feel to interact with them? What is your feeling of the society as such?
Well, actually, I'm so glad and so happy that I have the feeling inside. Actually, it was difficult to express. Today, Lupins have the Sakti Conclave 2022, and today I have seen so many women around, especially sharing our journey and discussing so many important things. As a sports, I am not much aware about such thing. The doctors has sharing the disease. So many women have that problem at the same time, and of course, related and associate with me is a really honor. Of course, I'm so happy that from my side what I can aware. I mean what I can give awareness from my side. I am giving to motivate or to make a stronger woman. That especially, and doctor has already given so many awareness to take the prevention all the disease, and of course I'm so happy and very so happy. I'm very excited.
So
Thank you.
that's the golden words from the legend herself, MC Mary Kom, and with our leading cardiologists. We at Scientific Scholar feel proud that we are contributing to the dissemination of high quality clinical content and contributing to the cause of improvising and improving healthcare for women. And we are pleasured to have the new face of the journal with us, and we look forward to much wider success of the journal and the society ahead. Thank you, everyone. Have a great day. Bye.
Thank you.
Thank you so much.
Thank you.